Aortic stenosis is a condition where the left ventricular outflow tract controller, the aortic valve, becomes narrow. As you can see there in the diagram, the picture on the left shows that the aortic valve is open, it is as indicated by the blue arrow. The picture on the right, you can see that the opening is narrowed, indicating the aortic valve is stenosed, and this will lead on to a blockade of the blood which attempts to come from the left ventricle and leads on to significant hemodynamic changes. Now the normal aortic valve area is about 2.5 to 3.5 centimeters square. Some books have given it as 3 to 4 centimeters square. But the narrowing of the aortic stenosis causes symptoms only when the valve area comes below 1 centimeter square or often 0.7 centimeter square, which is called the critical aortic stenosis. Now, in aortic stenosis particularly, the symptoms are far more critically important than what you auscultate and find, because symptoms correlates with the prognosis, and symptoms many times decides need for surgical intervention. Since it is an outflow tract obstruction, the pulse will be of low volume and it can be slow rising, what is called as pulsus parvis retardus. The systolic BP is often decreased, which is called the systolic decapitation, and it also leads on to a narrow pulse pressure. JVP is not elevated because, as I have already explained, the narrowing of the aortic valve leads on to a high degree of mortality, so the patients do not survive till they develop clinically identifiable right heart failure. Apical impulse can be shifted down. Some literature has mentioned that the apical impulse is shifted out, but it can happen either way. It does not produce any pulsation or parasternal heave because the right side of the heart is not significantly affected, and there is no significant volume of turbulence which is happening, which produces pulsation in the aortic area. The apical impulse is heaving, which indicates a sustained lift of the palpating finger. There is no palpable sound, and a systolic thrill may be palpable in the aortic area. The murmur of aortic stenosis is the ejection systolic murmur. You can see the arrow mentioned in the last, which indicates severe aortic stenosis. The murmur starts at S1 and ends before S2. The intensity appears to increase and then decrease. As you can see, it gives a crescendo decrescendo pattern or the diamond shaped murmur. The murmur is conducted to the carotid. The A2 is muffled and it can be absent in AS. It's an error that it is mentioned that S1 is muffled. The severity of AS is indicated by a late systolic peaking of ejection systolic murmur. You can see that in mild aortic stenosis, you can see the peak of the diamond happening before mid-systole, whereas in moderate it is around mid-systole, and in severe aortic stenosis it is happening after the mid-systole. The severity of aortic stenosis is also indicated by an absent A2 and presence of S4 in the apex.